Today I am here with Gil Hendricks to ask her a few questions about her daughter Teresa. She had spina bifida and she came to Dr. Stewart's chiropractic office to be adjusted. What type of spina bifida did your daughter have?
It was the severest form. It was the meningomyelocele.
Okay. And what signs and symptoms did you see?
In the beginning, it was just lower body weakness. She had to wear braces. But then as she got older and had shunt surgeries, in 1993 she had a series of 3 shunt surgeries. Now she had one at birth and it became disconnected at about age 6. But then in 93 she had 3, one right after another, 2 on one side, 1 on the other, and that caused occipital nerve damage. So she had severe headaches, and she started, as she became taller and trying to walk more, and she wanted to be very independent. She wanted to walk just by holding on to things and not using a walker. It caused a lot of lower back pain.
Okay. How did having spina bifida affect her life?
She told me that in the beginning she didn't feel like she was any different from anyone else. When she started elementary school, she had to use a wheelchair just to conserve her energy to get around. But like I said, she could walk around in the classroom or at home just by balancing to hold on to things. As an adult, it became much more pronounced, and so she had to eventually rely on a wheelchair completely.
Okay. What activities did you have to help her with every day?
When she was little, not much of anything. She had a brain imbalance in that she used her eyes independently. So helping her keep her place when she was doing schoolwork or reading or anything, she had to use some kind of guides. She was told at a very young age, you have to learn to catheterize yourself, or you're going to have some kind of artificial bladder. At a very young age, she said, I'm going to do this myself so that I'm not dependent on my mother or somebody else to do this for me. And so in a matter of a couple of days practice, she had it down. And I know she was probably in 6th, 7th grade, something like that. But she wanted to be able to do things like that independently. As she became older, that became more of a necessity. In the beginning, it was just to make sure the bladder's empty so there's no infection. So if she cathed once or twice a day, that was enough. Eventually, it became, at least 5 times a day. She, in her latter years, developed more nerve damage so that she lost a lot of upper body strength, and she would have trouble even holding her spoon to feed herself. But that was nerve damage in the neck, and she had surgery to relieve that. So it kind of depended on at what point she was in life, but she remained as independent as she could as long as she could.
I remember hearing her talk about some of the surgeries that she had. How many surgeries did she have?
No idea. I know she used to average about 2 a year when she was younger, and sometimes they were bladder procedures, but she had the closure at birth, the shunt, and then when she was about 18 months old, she had to have a hip Girard where her hips were like this, not like this, the hip joint. And so to hold that hip in place, they moved muscles around in the hip so that she could stand and walk. And of course, her walking was delayed, but the doctor said that, since she was trying to stand, they went ahead and did the surgery so that she could try to progress as normally as possible. She had to have both ankles fused because her feet were very limp. her feet were perfectly formed, which is unusual. Usually they're like bananas, the doctor described, but she had little arches, everything. Her both feet were perfectly formed. She had no feeling there, and so they did ankle fusions to try to stabilize that. She had to have both knees operated on because of damage from falls. She would fall a lot. When she was little, to get around, if she was in a hurry, rather than walk, she'd crawl. And so her knees took a lot of punishment. Let's see, and then in '93, all the shunt surgery, she had an Arnold Chiari condition. Did you study about that one? They call it kind of a reverse spina bifida. I don't think technically that's what it is, but she had a cyst on her spinal cord at C1. She had to have C1 removed, C2, C3 enlarged, the base of her skull enlarged, and again, all of that added to the nerve damage. She had caused more nerve damage, which increased the headaches. We tried anesthesia treatments where she gets injections of painkillers. That didn't work with her. We tried that twice, and she said each time the pain would come back, and it would come back more severe, and we were warned that that's a problem with having these types of procedures, so we didn't do any more of those. We did magnets, we did opioid therapies, and leading into the reason we're here, to try to control the amount of pain medicine that she was taking, we sought Dr. Stewart's help because she was having initially more lower back pain than anything. Now, we were afraid to get the head or the neck adjustments because of the surgery she'd had on the neck, but as her doctors saw how chiropractic helped her, they were a little more lenient about what we were about to do.
All right. I always saw her smiling,
Yes.
and she was always happy. Was she always that way, or?
Yes.
She was, for the most part.
Yeah, she was very determined to live, even as a baby. She was a fighter. She would not have lived as long as she did had she not had that attitude. But she never let on that she was in pain. She always told everybody she was fine. It didn't matter how sick she was, but she didn't let that be a problem to her, or she did as much as she could as long as she could.
Okay. Well, thank you for talking to me today.